Hello, my name is Jason Aldred. I am the owner of Selkirk Neurology and Inland Northwest Research. I am Associate Clinical Professor at WSU and University of Washington in neurology. I'm a board certified neurologist and a fellowship trained movement disorder specialist. I wanted to thank the Northwest Parkinson's Foundation for inviting me to speak on the topic of disease-modifying experimental therapeutics in Parkinson's disease today. Some exciting new updates and new initiatives that have come about in the last year focus on our continued efforts on alpha-synuclein monoclonal antibodies. These are chemicals that are designed to bind to and attack the parts of the Lewy body. Alpha-synuclein is made up of proteins that clump together and form Lewy bodies, and there's studies in a variety of phases ongoing right now. Phase 1 studies focused on safety. Phase 2 studies looking at effect and continued safety, and Phase 3 studies looking at sizable differences, which hopefully will lead to approval of these monoclonal antibodies, although yet nothing's been definitively proven, are being planned currently. And so we hope to talk a bit about that, review some of the science that you may have read about already, and talk about potential new opportunities for research you might participate in. Also, there's been some developments on the gene therapy front with the therapy to restore key chemical lost in Parkinson's disease. Amino acid decarboxylase is a chemical in the brain that converts levodopa to dopamine and is involved in dopamine metabolism, and it's lost in Parkinson's disease, or reduced in significant amount. So one of the ongoing studies has been to look at infusion of a gene therapy that can boost the amount of this chemical, this enzyme, that can help increase dopamine levels and we hope improve Parkinson's symptoms as well. I'm going to talk a little bit about the immune system and immunotherapy. The immune system is second only to complexity to the nervous system in terms of our parts of our body. Immunotherapy, if you think about it, stepping away from Parkinson's disease, it's revolutionized the treatment of autoimmune disease. Things like lupus, rheumatoid arthritis have benefited tremendously from state-of-the-art new immunotherapies, and certainly cancer, using the immune system, our own innate immune system, to fight off cancer and enhance aspects of our immune system and target it directly with monoclonal antibodies against different types of solid tumors, blood tumors. The nice thing about immunotherapy is using the mechanism similar to the body's own defenses to make it very well tolerable, to target an unwanted protein or something involved in a disease, and be able to fine-tune the dose, so allow for careful reduction of the amount of abnormal protein or whatever is causing the disease process. In this case, we're talking about alpha-synuclein that may be harmful to dopamine and other nerve cells producing Lewy bodies. This is a description of alpha-synuclein. Alpha-synuclein is a chemical protein that's supposed to be in the brain. It has a role that we're not completely aware of how exactly it works, but we think that it is involved in transportation of things within nerve cells. Unfortunately, alpha-synuclein can have a tendency to clump together, and when it clumps together, that's called oligomerization, or forming oligomers or groups. And then it can form into the next step, which is fibrils, which those become not dissolved in the fluid of the cell, but rather stick out from that and can clump later into Lewy body type inclusions, and it can decrease cell survival, it seems. So if we have a way of improving this process to push it more towards a dissolvable normal alpha-synuclein, or if alpha-synuclein starts to clump up, if we can make it so that it doesn't progress onto the development of Lewy bodies. So we think that there could be good ways of reducing progression of Parkinson's disease, lessening the effect of Parkinson's progressing over time. Alpha-synuclein, our understanding of the alpha-synuclein and progression of Parkinson's disease focuses largely on something called the BRAC hypothesis. These are two doctors who are pathologists that look at cells under the microscope and understand the tissue of the body well, brain tissue. And years ago, really, they did some really wonderful basic science research that suggests that the Parkinson's disease progresses in a fairly standard way from the brainstem up to the midbrain and then on to the cortex, the thinking part of the brain. And that's why we think we may see early symptoms of Parkinson's being things like constipation, as that is regulated more from brainstem centers. Lower down, and then the movement symptoms, more of the midbrain, happens halfway when the disorder's halfway through its kind of progression. And then you have movement disorder symptoms after some of the initial non-motor symptoms. And then later on, with very advanced Parkinson's disease, cognitive impairment and other cognitive issues as the Lewy bodies spread. And so this is the BRAC hypothesis, is how we've come up with this idea. And that's what the science is focused on, is trying to use some type of experimental therapy that we can show, hopefully to prove that it can reduce the progression of Parkinson's, kind of intervening in that process at the point where there's movement symptoms, maybe even one day before there's movement symptoms, but at this point when there's movement symptoms that are mild, to prevent the movement disability from becoming more significant, severe, and certainly trying to delay the effects so that dementia doesn't develop. Trying to prevent the spread from one cell to the other is key. Monoclonal antibodies are the name for one of the ways we look to do this. Again, these therapies are kind of in different phases of development. Nothing yet is in phase 3 that I'm aware of. This is kind of a picture of what would look like kind of a diagram of the normal cell here, developing some clumping of alpha-synuclein here, propagating into these clumps and being toxic to neurons, nerve cells. In that same cell, if there's the monoclonal antibodies binding to the alpha-synuclein before they clump, then they would be cleared and washed away, and in the usual garbage disposal mechanism of the brain to take care of proteins it no longer needs or other substances that it no longer uses to recycle, as cells are very efficient. Again, this idea here is also supported by what we see as inflammation in the brain. We call this gliosis, noted in Parkinson's disease throughout the brain. And we can see that if you put these alpha-synuclein clumps in cells, you trigger an inflammatory process. And it can really perhaps even cascade down and build on that and create more irritated nerve cells. One of the keys to this idea is we want to attach onto these clumps of alpha-synuclein that form Lewy bodies at the point when they're spreading from one nerve cell to another. That's how we hope to get at them, as you can't get the antibodies into the cells, but you're trying to rather saturate the areas outside of the cells so that you can hopefully attach to the alpha-synuclein clumps and wash them away. There's different types of immunotherapy that's been looked at for Parkinson's. One of the earliest studies was done in Austria many years ago, looking at active immunotherapy. This is more like a one-time deal where you get like a vaccination or maybe a booster. But this idea was to inject people to develop a tendency for their own immune system to do all of this. And there was quite a bit of variation between different groups of adults. And one of the problems that we see, of course, we're all now very well aware of how as you're older, your immune system is not as active, and certainly that makes you more at risk for viral infections, things like that. And also presents a challenge for active vaccination, where you give someone a single shot trying to stimulate their body's immune system to fight the alpha-synuclein in this case. So that approach has been looked at and not seen to be really robust enough to follow up through larger trials, so that there wasn't as much confidence in that. And that's why the next phase of these studies has focused on passive vaccination, and that means a repeated infusion. So we don't know yet what would be needed. It's not been proven yet, but we're looking at perhaps every several weeks or months or so, something like that, repeatedly administering a treatment so that it sticks around in the body and hopefully can wash out some of the alpha-synuclein clumps. This is all publicly released information on phase 2 clinical trials. There's a treatment BIB or experimental therapy BIB 54, SPARK trial in people with Parkinson's disease. Also another trial in this category, the Pasadena trial, looking at a prasinezumab with Parkinson's disease over a lengthy period of time to follow up. Now we're switching on to another idea. This is antisense oligonucleotide. So this is not immunotherapy. This is a different strategy. In this situation, there is a gene, a gene that is carried in DNA for Parkinson's disease that we're learning may increase the risk for Parkinson's. And the gene, through its normal process, what happens is the gene's converted to a signaling gene, call it messenger RNA. It's a messenger, and that gets made into a protein, which is supposed to do a particular job. If this is done in a way that's abnormal, it can, we think, stress the cell in a way that can increase the risk for Parkinson's disease and drive the progression of Parkinson's. And so the hope is that with this treatment called an ASO, an antisense oligonucleotide, it can bind to this messenger RNA, this in-between step of making a protein in the body, and it can alter the protein, make it less big or overexpressed in some cases. In other cases, it may deactivate the gene altogether if the gene is too strong. And remember, we do have genes from other copies, or another gene from another parent. So even if it's partially expressed, it still can work well, but not too well to cause a problem. Like what we see in current forms of Parkinson's disease, we think may be influenced by certain genes. Precise targeting of abnormal genes is the idea here. This is getting into the idea we'll talk about in a minute called precision medicine. So targeting abnormal genes to change the abnormal activity to bring it to a more normal level of activity. And one of the very exciting things about this is this strategy using antisense oligonucleotides has actually been used in a condition called spinal muscular atrophy. It's a condition many of you may not have heard of because it's very rare, but it's kind of akin to the pediatric version of Lou Gehrig's disease, if you could imagine that. If not many things more horrible than Lou Gehrig's disease, but of course children getting this is. And so think of it as kind of the nerves in children are not functioning well and degenerate because they contain this abnormal gene. So this has been an FDA-approved treatment. This treatment called Spinraza is an antisense oligonucleotide for spinal muscular atrophy. And so that's very exciting. So currently, again, for Parkinson's disease, the currently disclosed information is that there's phase 1 trials ongoing looking at this type of therapy. So back to genetics, you can tell we're talking a lot more these days compared to years ago about genetics and Parkinson's, and this does come up from time to time, but really we used to say that maybe 2 out of 100 people would have a gene causing their Parkinson's, and now we're getting up to the number of 8 to 10 out of 100 people may have a gene that causes Parkinson's, and a lot of us think that could even be just the tip of the iceberg. So what we know is that people with genetic risk for Parkinson's in a low-risk environment may never develop Parkinson's, and at a medium-risk environment may develop Parkinson's in older age, and may at a higher-risk environment may develop Parkinson's in their 50s, and it may progress more quickly, respond less well to meds. So there's a variety of factors here that we don't quite understand. In other words, to be clear, 2 particular genes, LRRK2 and GBA, are the 2 most common genetic changes we see in people with Parkinson's, and the vast majority of people that have these abnormal genes don't develop Parkinson's. So we're trying to figure out, certainly we're focused on certain types of experimental therapies to see if we can prove that this reduces the progression of Parkinson's, but also what are factors that trigger a development of Parkinson's in people that have genes, in some people, versus other people that have the genes that don't develop Parkinson's. And things that are being looked at are stress, exercise, diet, medications, other medications, environment. So there's a lot of factors to consider. Gene targeting is a specific type of what we call precision medicine. So right now, an example of kind of a general approach to medicine is taking people that have had stroke and putting them on aspirin to prevent recurrent stroke, because we know that that reduces the risk of stroke. In the future, we hope to perhaps identify people that have stroke and have a certain genetic background, and we would probably continue to use aspirin, but we may have other specific types of therapies that would be designed to their particular type of genetic abnormalities for inflammation or other issues. And turning that idea over to Parkinson's disease, we know that people at Parkinson's disease have certain environmental risk, may have family history, but if we can identify a specific gene, for example, the LRRK2 gene, that we may treat that particular form of Parkinson's disease with an abnormal LRRK2 gene differently than you would treat Parkinson's disease without the LRRK2 gene, or probably the same symptom treatment, but it may be other types of treatment if we're able to get past the experimental phase, therapies that might be able to slow the progression if they're focused on that particular gene. Another exciting area is the GBA in Parkinson's, GBA gene. This is glucocerebrosidase. It's part of the pathway that, again, is involved in throwing away abnormal proteins, and we see that it's mutated. This chemical that the gene makes, called glucocerebrosidase, can't organize itself appropriately, and it causes a lot of stress on the cell, particularly those that have dopamine functions have a low threshold for becoming abnormal, not functioning well, we think die. So this all came about from research on Gaucher's disease, which is a genetic abnormality where you have two abnormal copies of the GBA gene, and this results in younger people having multiple system issues in many different parts of their body, dementia, and they live long enough to develop Parkinson type symptoms, which is one of the reasons that this was discovered after hard work of lots of investigators over the years. And the Parkinson's disease, having one abnormality and this GBA gene, can put you at risk. You don't develop the actual Gaucher's disease. Venglustat is a investigational oral drug that can affect the glycosphingolipid metabolic pathway that can be relevant here for treating GBA abnormalities in Parkinson's disease. Again, it hasn't been proven effective at this time, but it was under investigation. A phase 2 trial has been completed, and press releases have stated that they're looking towards a phase 3 trial. LRRK2 gene is the second most common gene abnormality seen in Parkinson's disease. The name of a protein it creates is called the leucine-rich repeat kinase 2, hence named the LRRK2. Mutations are observed in autosomal dominant forms of Parkinson's, which means you only have to have one abnormal copy of the gene to develop Parkinson's or have an increased risk. We think that it overactivates or makes this protein overly active, and it can impair dopamine function, and that's why we want to make it less active. If a patient does not carry the LRRK2 mutation and has Parkinson's, we're looking at the possibility that perhaps the therapies can still be beneficial to other people with regular Parkinson's, because you see that there's published information about even those people with regular Parkinson's disease without this gene may have increased abnormalities in the LRRK2 kinase. Recently, there's some information released from Denali, a company that's focused on Parkinson's experimental therapies. Some data from their phase 1b trial showing high levels of engagement, kind of interaction of the abnormal chemical in lysozyme biomarkers in Parkinson's with their experimental therapy. The medicine was reported to be, or the experimental therapy is reported to be, well tolerated. There was some headache and nausea, but overall well tolerated, and hope to hear more about this after the initial announcement that these experimental therapies may move into another stage clinical trial later on. Other information is the BIB-094 is a compound that's been under investigation in phase 1 level of study for Parkinson's research that is targeting appears to areas for people carrying LRRK2 gene and non-carriers of LRRK2 gene with Parkinson's disease. And this is delivered into the spinal fluid in a single dose and multiple doses against placebo. So one of the things that certainly we want to raise interest in, and hopefully you all will research more, is at this time learning your gene status. Certainly, if you have a genetic form of Parkinson's, you would be a candidate perhaps to consider one of these clinical trials and participating in this to move the research forward. People that are younger onset Parkinson's and those that have a family history of Parkinson's disease are at increased risk of having genetic form of Parkinson's. Biological Jewish lineage may have an increased risk. And so certainly look out for available local, hopefully cheap or free with research studies and accurate genetic testing. 23andMe does have some utility in this and other commercially available direct-to-consumer testing, but we do recommend that you pursue a more research-grade type of testing, certainly before you would enter into a clinical trial or some other confirmatory testing. Genetic counseling, of course, if you have questions about that, should be pursued before you have testing or afterwards if there's questions. And very excited to offer these trials locally in Spokane to folks in our area. We have a lot of people traveling over from the western side of the Northwest, Seattle and Portland as well, and as well as our own local areas in western Montana and North Idaho. So I just have a couple of slides here about precision medicine. I'm going to kind of gloss over as we've talked about a lot of this here. I wanted to also think about how precision medicine or personalized medicine is not necessarily just these fancy genetic experimental therapies we're talking about, but it may be that if we learn that your particular type of Parkinson's is more responsive to the diet or the microbiome, that may be of relevance as well. We think about tremor-dominant Parkinson's disease as maybe progressing more slowly, so that we can learn more about specific types, like the specific types of Parkinson's disease. We may treat them differently as well if there's a genetic signature for that. If you're at risk for Parkinson's disease, then in the future we may learn about particular types of exposures to avoid, which we don't yet know. We don't yet know quite how to talk to people about that in a reliable way. One example, though, is we do know that redheads, like myself, have a higher risk for sun-related melanoma and should be more diligent about sunscreen. So, that's an example of how understanding, your genetic tendency towards something can shape your behavior and avoiding certain risk factors. And we hope to have more information in the future and more precision medicine to also that can be used by the public and those at risk for Parkinson's to lower their risk of Parkinson's disease further by taking steps with how they live their lives. So certainly we want to encourage everyone to consider participating in a clinical research study if possible. Clinicaltrials.gov is really a great site that we do recommend for looking at studies, comparing different studies, looking at finding sites in your area in the Northwest or beyond that may be suitable for participating in research. You can take part in the big battle, fight against Parkinson's, and as we incrementally kind of drudge along here day by day, I think I'm ever more optimistic that we'll come to a time when we'll have some major breakthroughs to announce. That really, I do have faith that day is coming sooner rather than later. So certainly look us up or any other research groups in your area and ask questions. Thank you.